Good afternoon. I am Raffaello Bonacchi. I'm a neurology resident at the San Raffaele Hospital, Milan. I'm going to talk about cardiovascular risk factors and how they affect brain volume in young multiple sclerosis patients. Previous studies have associated cardiovascular risk factors with changes in clinical and MRI outcomes in patients with MS, but they have not set an age limit. While we know that older patients may be affected by cerebral small vessel disease-related damage in addition to MS, and previous studies have also not attempted to grade the strength of exposure to risk factors. So we aim to investigate the impact of cardiovascular risk factors also by grading them on T2 hyperintense lesion volume and brain atrophy in patients with MS under age 50. We enrolled 124 MS patients and 95 age and sex matched healthy controls who underwent neurologic assessment and brain MRI acquisition on a 3 Tesla scanner with pulse sequences for assessing lesions and atrophy. We extracted T2 hyperintense lesion volume and normalized white matter, gray matter, and brain volumes. Then we assessed presence of traditional cardiovascular risk factors, namely smoking, hypertension, dyslipidemia, and diabetes history, and we also used more stringent cutoffs for the same risk factors, namely having smoked more than 10 pack years or being treated for hypertension, dyslipidemia, or diabetes. Then we used linear models adjusted for age, sex, disease duration, and phenotype and treatment in order to determine the impact of cardiovascular risk factors on MRI variables. Our cohort of healthy controls was age and sex matched with MS patients who were mainly with a relapse and remitting phenotype, had a median disease duration of 8 years and a median EDSS score of 2.5. Risk factor exposure was more prevalent in MS patients than in healthy controls, and the most prevalent risk factor was smoking. The presence versus absence of at least 2 traditional cardiovascular risk factors was associated with brain, gray matter, and white matter atrophy in MS patients, but not in healthy controls. There was no significant effect on T2 hyperintense lesion volume. The presence versus absence of at least one more stringent risk factor was associated with both a higher T2 hyperintense lesion volume and a lower normalized brain volume, normalized gray matter volume, and normalized white matter volume in multiple sclerosis patients, but again, not in healthy controls. So we can conclude that the presence of cardiovascular risk factors is associated with brain atrophy, involving both the gray matter and the white matter in patients with MS, even under age 50. And cardiovascular risk factors seem to have synergistic effects, determining brain atrophy even for levels of exposure that may be often overlooked by a clinician when present in combination. Thank you.